morning, my name is Kinzie Lee, and this is Erica Reott, and we're from the National Center on Birth Defects and Developmental Disabilities at the Centers for Disease Control and Prevention. And the mission of our center is to promote the health of babies and adults and enhance their potential for full and productive living. To that end, we're working to understand and prevent birth defects. Birth defects affect 1 in 33 babies born every year, 1 born every 4.5 minutes, and are a leading cause of infant deaths. Most of us know someone who's affected by a birth defect, whether it's a child born with a cleft lip and palate, a young girl maybe with Down syndrome, or someone with a neural tube defect. While we don't have proven prevention strategies for most of these birth defects, we do know how to prevent many neural tube defects. Today we'll present a critical opportunity for public health law, corn masa flour fortification for the prevention of neural tube defects. Neural tube defects, also called NTDs, are severe birth defects caused by the skull or the spine not closing completely during development. You may have heard of 2 types of NTDs. There's anencephaly and spina bifida. Most babies born with anencephaly, they die in infancy, while spina bifida results in varying degrees of paralysis and lifelong disabilities. These NTDs affect 3,000 babies in our country each year, 3,000. Fortunately, the majority of NTDs can be prevented simply by women taking 400 micrograms of folic acid daily during and before pregnancy. This can be done easily through diet or through vitamin supplements, but we've seen the most success through fortification, which is adding folic acid to certain foods when they're made. Fortification helps ensure that women have enough folic acid without them having to make any specific efforts to get it. In the United States, grain products labeled as enriched have folic acid added through fortification, and this has led to lower rates of NTDs. However, Hispanics continue to have disproportionately higher rates of NTDs than others because many of the staple foods consumed in the Hispanic communities are made from corn masa flour, like corn tortillas and tortilla chips, which are not fortified the same way that cereal grains are.
All right, so let's talk for a moment about where the law fits in. Currently, the FDA regulates food by issuing standards of food identity and regulating food additives. And these requirements say what a food must contain to be marketed under a certain name and what additional ingredients may or may not be included. FDA has required all cereal grain products labeled as enriched to include include folic acid since 1998. But current regulations do not permit the fortification of corn masa flour with folic acid. This is where we think the critical opportunity lies. In 2012, a coalition of national organizations submitted to the FDA a petition to fortify corn masa flour with folic acid, which is the type of flour used mostly by Hispanic communities. And this is one way we could reduce the disparate NTD rates among Hispanics. At current time, FDA is in deliberations about whether or not to permit corn masa flour fortification. As we've mentioned, food fortification with folic acid has been done in the form of flour, and the results have been impressive. Over the last decade, food fortification has proven to be one of the most effective public health interventions, even being identified by CDC as one of the top 10 greatest public health achievements of the past decade. We've reduced NTD prevalence by 36%, and that's about 1,000 babies born each year without an NTD, where we might have expected them to otherwise have one, or 3 per day, and a cost savings of $4.5 billion, which is saving $100 for each $1 invested. Translating these impressive successes to corn masa flour fortification could prevent many NTDs among Hispanic babies. We think fortification is a feasible, safe, and effective public health policy to prevent NTDs. It is cost-saving, which is exceptional among public health interventions. Possible challenges to this policy are anti-fortification groups, perceived safety concerns, and lack of awareness about folic acid among Hispanics. As we mentioned, a national coalition has developed and submitted a petition to FDA that would allow for the fortification of corn masa flour. The way forward is clear. Fortifying corn masa flour could reduce disparities, improve quality of life, and save babies from neural tube defects. Thank you.